Transforming the public image of nursing and the critical role of nurses in policy and politics. The professional identity and image of nursing are crucial for the perception and effectiveness of the profession, influenced historically by stereotypes that range from idealized to negative portrayals. These stereotypes impact healthcare delivery, recruitment, and the roles attributed to nurses within healthcare teams. A strong professional identity enhances nurses' pride, responsibility, and commitment, positively affecting patient care, job satisfaction, and retention. Conversely, a negative image can lead to demoralization and impact the profession's attractiveness. Nurses' involvement in policy and politics is vital for advancing patient safety, public protection, and healthcare reform. Their frontline experience and understanding of the patient needs position them uniquely to advocate for effective health policies. Addressing stereotypes, promoting a positive professional image, and engaging in policymaking are essential steps for nursing's evolution and its role in shaping a responsive healthcare system. Professional identity and image, common stereotypes. Nursing has historically been encumbered with stereotypes that range from the angel at the bedside to the handmaiden of the physician. These stereotypes, while sometimes positive, often undermine the true complexity and skill set required in nursing. They fail to acknowledge the critical thinking, technical competence, and high level of education involved in modern nursing practice. Such simplifications not only demean the profession, but also obscure the significant contributions nurses make to healthcare and patient outcomes. So we're gonna play a video with a humorous example of these stereotypes.
Some of you may recall this lady. Her name's Jessica Anderson, and she's a nurse at the Royal London Hospital. And she ran this year's 2019 London Marathon in the fastest time whilst wearing a nurse's uniform. And you may recall that she was denied that record by the Guinness Book of World Records because she was not wearing a nurse's uniform. That is her nurse's uniform. Now, what the Guinness Book of World Records would actually have us believe is a nurse's uniform is this. In my 30 years of nursing, I have never seen a nurse's uniform like this, least of all being worn by a man.
Advocacy efforts. Organizations like the former Center for Nursing Advocacy and the actual Truth About Nursing play fundamental roles in combating these stereotypes. They work tirelessly to correct misconceptions and promote a more accurate representation of nursing. Their strategies include media monitoring and response. These organizations monitor media portrayals of nurses and respond to inaccuracies or demeaning representations through campaigns, open letters, and social media engagement. Public education. They engage in public education efforts to highlight the roles, responsibilities, and expertise of nurses. This often involves speaking engagements, informational campaigns, and educational materials. Collaboration with media creators. By working directly with filmmakers, television producers, and writers, these organizations aim to influence portrayals of nursing from the production phase, ensuring more accurate and respectful representations. This is from the organization I mentioned earlier, Truth About Nursing.
How do we bridge the gap between stereotypes and real nursing? The media ignores nurses. Only 2% of health articles use nurses as expert sources. Journalists don't know what nurses do or how to find them. Hospitals offer only physicians to talk to the media. Hollywood nursing is done by physicians. Nurse characters obey commands, fetch things, and do menial tasks. This matters. Research shows the media has a real effect on healthcare decision-making. Poor public understanding means nursing lacks the resources it needs for education, research, and practice. Nurses burn out. patients suffer and die. But we can change the media. We have changed the media, removing these images. Be part of the solution. The Coalition for Better Understanding of Nursing unites nursing groups to educate the media. We highlight nursing achievements and ideas, present nurses as expert sources, encourage nurses to speak up. Join us to build a better healthcare system at nursingcoalition.org.
Transforming public image. Changing nursing's image in the public eye requires a multi-focus approach, highlighting diversity and complexity. Efforts to be made to showcase the wide range of specialties within nursing, the diverse backgrounds of nurses themselves, and the complex decision-making involved in their daily work. Promoting nurse leaders, elevating nurses in leadership positions within healthcare can help change perceptions about the influence and autonomy of nurses. Educational campaigns. Public education campaigns that detail the rigorous education and continuous learning required in nursing can help shift public perception. Interacting with the media. For nurses to positively influence their portrayal in the media, several strategies can be effective. Media training for nurses, for example, offering media training to nurses can prepare them to engage effectively with journalists, handle interviews, and present their work compilingly. Proactive media engagement. Nurses and nursing organizations should seek opportunities to share stories of nursing innovation, leadership, and patient care successes with the social media. Social media presence. Nurses can use social media platforms to share insights into their professional lives, highlight achievements, and correct misconceptions in real time. Nursing policy and politics. Political skill in nursing. Nurses equipped with political skills such as strategic communication, networking, and negotiation stand as formidable advocates for healthcare reform. Understanding and navigating the legislative process allow nurses to effectively influence policy, ensuring it aligns with the practical needs of patient care and the nursing profession. Such advocacy is crucial for the development of healthcare policies that are not only realistic but also equitable and effective. Amplifying nurses' political influence. By actively participating in professional associations, policy discussions, and health reform initiatives, nurses can significantly amplify their political influence. Grassroots advocacy, alongside collaboration with health policy organizations, position nurses as powerful advocates in the political sphere. Leveraging personal stories and frontline experiences, nurses can articulate the need for policy changes and health reforms in a manner that resonates deeply with policymakers and the public. These actions not only bolster nurses' roles in policymaking, but also ensure that health policies are crafted with a comprehensive understanding of patient care and healthcare delivery. As we conclude this presentation, it is clear that transforming the public image of nursing and fostering active involvement in policy and politics are not just goals but necessities for advancing healthcare. By challenging persistent stereotypes, engaging constructively with media, and harnessing political skills, nurses can effectively influence health policy and reform. The future ahead requires both individual dedication and collective action to redefine nurses' professional identity and solidify its indispensable role in shaping the future of healthcare.